Hello, Professor. Greetings for the day. Me and my team will be sharing the case scenario about consent and refusal of care. Let me introduce you to the characters of this play. Mrs. George, who is a patient, Mr. George is the husband of Mrs. George, Dr. Smolder Bravestone, who is attending physician, Peter Parker is nurse, Mr. Atkinson is the social worker of the hospital, and I will be playing the role of narrator in this scene. So, our video presentation is about Mrs. George's case, a 66-year-old Aboriginal woman who has had diabetes for 35 years. One day, watching her favorite TV series, she noticed that there is a wound on her left leg.
Honey, will you come here for a second, please?
Okay, I'll be down in a bit. Yeah, what's wrong, honey?
Take a look at my leg, please. The wound seems to be getting worse. I can't walk and move properly. It all started from a small wound, and I don't have any idea and what happened now. It is getting worse and it is getting bigger and bigger, honey.
Uh-oh, it's looking bad, honey. It's infected. Okay, I'll book a teleconsult appointment with Dr. Bravestone.
Sounds good.
Then a teleconsult was set by Mr. George. Then, 1 week after the teleconsult appointment,
Good morning, Mr. and Mrs. George. My name is Nurse Peter Parker, and I'm one of the nurses here at Smallville Medical Center.
Good morning, Peter. How are you? We're here to see Dr. Bravestone. My wife is having a hard time with her leg.
Yes, he will see you after his teleconsultation with another patient. Since you've already filled out the information that we need from Mrs. George, you need to check her blood pressure, pulse and weight, and then I'll see your leg, Mrs. George, to assess the wound.
Yeah, okay.
Okay,
Okay, Mr. George, kindly prepare your BP apparatus, pulse oximeter, and weighing scale.
give me a minute, okay?
Sure, Mr. George.
Mr. George has been taking his wife's vital signs since she was diagnosed of diabetes 35 years ago. Vital signs were taken and recorded, and Dr. Bravestone is ready to see the couple.
Good morning, Mr. and Mrs. George. How are you?
Hello, Dr. Breviston. I'm not really feeling well. My leg is swollen due to an infected wound, I guess.
Let me see. Okay, focus your camera on the leg where the wound is.
Okay, doctor, wait a second. My husband will assist me.
All right, I can see it now. Mm, yeah, your wound is really infected. Tell me how it all started.
I'm not sure, doctor. I just noted from last 5 days and I don't know where I got it.
Okay, are you taking your meds religiously?
Yes, doctor.
Okay, I will run some tests including FBS, urinalysis, and HbA1c. And for the meantime, I will prescribe antibiotics and let's see after a week. Okay? And also, I'll have to ask you to do daily wound cleaning. I'll see you after 7 days.
Thank you, Dr. Breviston. Have a good day. Bye.
You too, guys. Bye.
As the days go by, Mrs. George's wound is getting worse. She has been taking the
Thank you, Dr.
prescribed
Bravestone.
antibiotic
Have a
for
good
a
day.
week
Bye.
since she sought teleconsult with Dr. Bravestone, and yet there are no signs of improvement.
Good morning, Mrs. George. How are you?
Good morning, doctor. The antibiotic doesn't seem to be work at all. My wound is getting worse every day. I don't know what's wrong. I'm taking medicine according to your instruction. I'm also cleaning wound every day with antiseptic solution.
Let me see, okay? I'm not seeing any improvement. It has severed and has developed gangrene. I have your lab's results. Your WBC, FBS, HbN1c are so high. I know you're taking your meds for diabetes seriously, and no one wants this to happen.
Yeah, I really don't want this. I'm scared of the complication. What should I do now?
Mrs. George, I will do my best to help you. I have to admit you so we can take care of you, and also your wounds. Your antibiotic will be given through IV line.
Okay, I hope it will work. Let me discuss with my husband.
The couple discussed about the treatment plan and decided not to be admitted at the hospital just yet. They wanted to set up another teleconsult appointment with her doctor.
Good morning, Mrs. George. I'm the nurse for the ship.
Good morning, Peter.
Have you taken your breakfast? Did you sleep well last night?
Yeah, I slept well last night, but I have not taken my breakfast yet.
I see. It seems that something is bothering you.
Yeah, I'm worried about my leg. Actually, I don't wanna die.
I understand how you feel, Mrs. George. We are doing our best to make you feel better.
Thank you for calming me, Peter. I hope everything will be okay.
Now on the phone with Dr. Bravestone.
Hey, how are you, Mr. and Mrs. George?
We are really worried about her leg. It doesn't look good.
If the tissue on her left leg is already affected by the infection, it's a condition called gangrene.
I'm so sorry, doctor. Will you explain me it further? I don't understand.
As you can see, the color of the skin around the area is already turned dark. So it's a sign that the tissue on that area is already dead and the swelling keeps on getting worse.
What should we do? Is there any treatment we can do for my wife?
We will remove the dying part of her left leg. The procedure will help to stop the spread of the infection to the other parts of her leg and to save the remaining part of it. It will ease her pain. If we do not remove it, the risk of the infection spreading is very high, and this might put her at more danger.
No, 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 doctor. It can't be. This is not happening.
Anna, Anna, calm down. Everything will be okay, alright? Everything will be okay.
Mrs. George, I can tell that this must be hard on you, but this is the best option to save the remaining part of your leg.
But will I still able to use my other leg? Will I be able to stand my own, walk and move my own?
There's therapy and rehabilitation after the operation. It will help you return back to your normal routine. It will help you adjust to being again after the procedure, and all of us is here to support you on your journey.
Understand, but I don't know. I can't seem to live with the fact that I will be living with one leg only, being so different from how God created me. I was born with two legs and I would like to die and being buried with two.
Honey, everything will be okay. If that is the only way to save your life, I will definitely say yes.
I can't, John. I can't, John. I can't. How I am supposed to be okay, John, when all of you want my leg to be removed?
Honey, don't think like that. We only want what's the best for you.
Is it the best? How is the good that I will be clipped rest of my life? That all my life I will rely on you? Tell me.
Why? Why do you see it that way? I can't understand that you choose to view it that way. I love you, and I just want to see you get better, to live your life.
How is that living my life? How is that being better? No, I will never do that. I will never agree to it, John. I will never. I was born with two legs and I will die and burn with two legs. That's it.
You're so irrational. You'll rather let yourself be at risk, see yourself hurting and the people around you because of that nonsense? God loves us. God will understand. It is you who don't.
Okay, Mr. and Mrs. George, let's stop this argument. Would you like me to set up a meeting with you and a social health consultant? It might help you to let go of the frustrations you have it. It might help you to clear your mind only if you want me to.
Okay, Doc, that sounds a good idea.
Dr. Bravestone set an appointment of the following day with the hospital social worker for Mr. and Mrs. George to do consulting.
Good morning, Mr. and Mrs. George. How are you today?
Good morning, Doctor. Me and my wife were talking about this situation till 2 a.m. last night, but could not get to any decision, as she was really devastated about the condition of her leg.
Doctor, I still can't imagine that I'm walking with only one leg for rest of my life. I still have some hope that I will be cured without this surgery.
I understand your confusion, Mrs. George, and that's why I have called Miss Atkinson to help you think more clearly in this situation. She is our social health consultant here at Smallville Medical Center, and I called her to talk to both of you.
Good morning, Mr. and Mrs. George. Dr. Bravestone has already told me about the condition of Mrs. George. I am here to help to lessen her anxiety because of her medical condition and the decision she needs to make.
Please, Mr. Atkinson, help me find out some other way. I don't want my leg being removed.
I know how you feel right now, Mrs. George. This must be hard on your part. No one deserves this, and no one is facing you to decide that against your will. We respect your decision. In the end of the day, still your decision matter. The hospital staff did the best they could to save your leg. They know how important each part of your body, especially your leg. But it seems your illness caused this. That's why we are in the situation now.
It is because I was born with two legs, dear. I can't die having my body with one leg removed. Also, I have lived my whole life with both of legs. Now how will I be able to do my everyday task with one of them removed?
This George, God has created all of us with two legs and two hands to help us live better. But when only those extremities threaten us for our life, there is no harm in removing it. And this condition can happen to anybody. One of my own friends, who was only 26 years old, lost his right arm in an accident. It has been 2 years now, and he has managed to live the rest of his life with one arm peacefully. He goes to gym, he is working in store, and he is happy with his life. If he did it, I know you can also make it. You can live happy even some part of your leg is missing. Your husband is always happy to see you each day. He loves you so much. I hope you won't give up on him, and the hospital staff know what is the best for you, and in order to save your life, they must remove some part of your leg. They don't want to harm you, Mrs. George. They only want what is the best for you, what is best in the interest of their patient.
Okay, I understand now. But how about my normal life? How will get back to it?
Do not worry about it. After you get recovered with your wound, you will be guided on your recovery like physiotherapy, and once you will get to your normal life again, you will feel more better without that irritating wound.
Well, in that case, please allow us some time to think about it one more time.
For sure, Mrs. George, we will just be right there.
After 15 minutes of discussion,
My wife has decided she will go with the surgery.
Yes, I understand now. Although it is very difficult for me, I will do it because I can live without a leg, but I can't live without a life. And I if I don't do this, this thing will put my life at risk. I know.
Very well said, Mrs. George. We are proud of you.
Thank you, Miss Atkinson. Because of you, my wife changed her mind about the surgery. Thank you so much.
I'm very happy for both of you. I'll take your leave now. Bye, Mr. and Mrs. George. Goodbye, Dr. Bravestone.
Bye, Miss Atkinson. See you again. I will ask the nurse to bring the informed consent for you to sign it. It is for legality. By signing this, it means that you are well informed that about the pros and cons of the surgery, and no one forced you to change your mind. I will also set the schedule of your surgery as soon as possible. I'll see you.
The surgery was done and went according to the plan. Mrs. George has fully recovered after the surgery and she is currently undergoing the physiotherapy. Mr. George never left his wife. He supported Mrs. George throughout her recovery.